Hello and welcome to the month of October. There are 89 days left in the year 2021. In this week's episode, we pause to reflect and remember some of the retired and active Grenadian educators who died during this dark period of Grenadian history. Some teachers fell victim to the COVID-19 pandemic, while others died of other unrelated illnesses and complications. Their losses happened against the backdrop of the celebration of World Teachers' Day, which is observed on October 5th. The theme of this year's World Teachers' Day event is, quote, "Teachers at the heart of education recovery," unquote. Also on our program, we examine the impact that Grenada's first COVID-19 wave has had on the country's senior geriatric homes. Some homes are managed and operated by the Roman Catholic Church of Grenada. Others are government-owned, and the rest are informal community-oriented living centers. In total, close to 15 seniors succumbed to COVID-related complications across these geriatric care facilities. Bishop Clyde Harvey addressed the issue on the Good News Catholic Communications Conversation with the Bishop recently.
So what happened with COVID-19 is that we were doing certain things. Certainly in terms of the senior homes, I was trying to plan for the future. We had developed a management committee and a structure at St. Martin's, and we were beginning to look at Hilarion Home and so on. And then all of a sudden, this explosion takes place. And St. Martin's proved that the work we were doing there was the right work. And I really have to commend that home. I discovered certain things about the Hillsview home, which I hadn't known before. Some of them very good, and Sonia Duncan is really working at her best. And then we came to Hilarion, and a whole set of other things came up. And we're now realizing what you discover sometimes in the midst of a crisis, that if you want to be honest, you have to go deep. You can't be satisfied with the superficialities.
We also pulled the curtain back on the impact of COVID-19 on Grenada's differently abled community. According to the United Nations Office for Disaster Risk Reduction, there are 85 million people living with disabilities in the Americas and in the Caribbean region. The agency says, quote, "Due to existing barriers in their environment, people with disabilities tend to live in situations with greater vulnerability than other social groups and are more likely to experience conditions of poverty or extreme poverty. The magnitude of the emergency generated by the COVID-19 pandemic has far exceeded the response capacity of government and other service providers," unquote. Also, for the first time since the beginning of September, Grenada is seeing a significant lowering of the COVID-19 curve in its first wave. There are now less than 415 infections per 100,000 people reported in the last 7 days, with an average of 66 daily infections reported. Grenada's vaccination rate is still one of the lowest in the developing world. We welcome our guests, Bishop of the Diocese of St. George's in Grenada, Clyde Martin Harvey; Kenny James, former president of the Grenada Union of Teachers and educator; Lydia Thomas, government administrator at the Desk of the Elderly; Clifford John of the Grenada National Council of the Disabled; and Nicholas Snag, President of the Grenada Association of Retired Persons. We thank you for joining us. A pleasant good day to everyone, and we welcome you to yet another installment of the Bubb Report, our first for the month of October in 2021. It's a beautiful fall day here in the Washington, D.C. area. And I begin as a point of personal reflection, and I want to take this time to pay tribute to one of my former primary school teachers who died last week, Mrs. Helena Patrice of Carriacou, St. Andrews. On my last visit to Grenada, I spent the better part of 1 hour reconnecting with her at her Lambert Bridge residence. She beamed with pride at what I've accomplished, and I also reminded her about her legacy as a stern disciplinarian and a no-nonsense professional. Mrs. Patrice was the tough love type of educator, and when she walked the hallways of the Pomrose RC School, you had no choice but to acknowledge her steely presence. She had a particular charisma of discipline that engendered a sense of good order and good behavior among the student population. Helena's teaching style was such that she demanded nothing but the best from her students. Their books had to be neat with no dog ears, their pencils always sharpened, and students had to come prepared to learn and participate in class. My classmates either dreaded going from her standard 3 to standard 4, from standard 3 to standard 4, or wondered what the experience was going to be like because Miss Patrice had a reputation of being so strict at the school. She also had a very notorious strap that has come very famous at the Pomrose School. As a standard 4 teacher, she played a crucial role of preparing her students for the common entrance class in standard 5, a role that she played with passion and perseverance. I therefore take this time to extend my deepest condolences to her 3 wonderful children who, like her, also contribute to Grenada's public service landscape. I also extend my deepest condolences to her husband and her immediate and extended family, as well as to the community of Carriacou and Pomrose. She was a dedicated public servant who gave her entire life to the education of Grenada's children. May she rest in eternal peace, and may her legacy live on through the lives of the people she impacted, including myself. Mrs. Patrice, thank you for your service, and thank you for the impact you had on my life. And at this time, I wish to welcome the first panel segment for this week's program. We were supposed to have Brother Roll Patterson of Carriacou and P.T. Martinique, a correspondent from the sister islands, but he's had some technical difficulties. And later in the program, we're going to have Mr. Kenny James, former president of the GUT, and who is also an educator, to talk to us about World Teachers' Day, which will be celebrated on October 5th. But at this time, I wish to welcome my first group of panelists, Lydia Thomas of the Desk of the Elderly in the Ministry of Social Development, Mr. Nicholas Snagg of the Grenada Association of Retired Persons, and Bishop Clyde Martin Harvey, the Bishop of St. George's in Grenada. Panelists, welcome to the Bubb Report.
Good morning to you.
Yes,
Nice
yes,
to meet you.
absolutely.
Good morning.
Yes, it's good to have you here, and we are meeting under some very difficult and sad circumstances. Certainly, the COVID-19 pandemic has affected the senior population in Grenada disproportionately if we look at the data. And so, Ms. Thomas, I want to begin with you. You represent, of course, the government of Grenada in this morning's program. And could you tell us the impact with respect to deaths, but also the impact with respect to caregivers, the matrons and the other caregivers at your facilities, government-run facilities, who were impacted by this first wave of COVID?
Well, again, thank you for having me. And the impact has been twofold. We've had impact based on our facilities and our older persons out there in the communities. We have an increase in neglect from family members. We've been looking at that because family members tend in this time, COVID-19 time, to look for themselves, look after themselves, leaving older persons to find means and ways to cope on their own. And that has been an issue for us. In the homes, we've seen staffing affected because some of the staff themselves has been infected with the virus. They isolated at home, leaving the matrons and managers to shuffle things around to see the staff they have on board, how they can give older persons the care that they need. And I know that has been a problem in most of the homes that has been affected with COVID-19. We have some psychological impact, both in the home and in the community. We have persons, older persons, wondering what next, if they're going to be affected, concerned about their health and their age. And the ministry has been giving some support with the homes with psychological support. We have done 3 homes so far and giving some psychological support to the staff and so on. That is a big concern for us. In the community, we have persons who have the ability to function in this period. You know, we have long lines in the banks, supermarkets, to get into the supermarket. And that brings us to our theme for Month of the Elderly, digital equity for all ages. Most of our banks and so have gone online. Are they capable, you know, to function in this way? Is there persons there to assist them? Yes, we have access to resources for older persons in our community because remember we have our medical staff are coming down with the viruses. They are home, so we have staff shortage in our medical stations. Are they getting the support that they need with their medical needs? So we have so much impact. Yes, in our homes we know Father will tell you that the management structure even has been affected. We have persons who really seem to cannot cope with the loss of their residents, and it's hitting some of the managers hard. So even in that area, we go in and we give some psychological support, psychosocial support to the matrons and residents of the homes.
In terms of deaths, what does that look like? How many seniors at your homes that you manage have died?
Well, to
Do
be
you have those
honest, we
numbers?
oversee
Yeah.
all the we oversees all the home. We oversee all the home in Grenada, Carriacou, and PT Martinique. We have 4 government-owned homes, but all the homes are being normally be assessed and overseen by the Ministry of Social Development and the Desk of the Elderly. I do not have the numbers, but we know that Hilarion Home has been hardest hit. I think it's approximately 10 deaths we've had in Hilarion Home. Hillsview Home, I think, had 2 deaths. We've had 1 in Cadrona Home in St. Andrews. St. Martin Home has had one death so far. So I think that's the deaths so far. And Top Hill Carriacou had 2 deaths, I think, in Top Hill Carriacou. But most of our homes, 7 out of our 13 homes in Grenada, Carriacou, PT Martinique, have been affected so far with COVID-19. Some of them have no deaths, but they have positive cases.
And I'm going to bring in Bishop Harvey here. Bishop Harvey, welcome to the Bubb Report. This is your first appearance. Certainly, we would like to have you back. Yes, and so thank you for taking time out of your pastoral duties to be here.
Yes.
And so, Bishop, the question is the impact on the homes. Looking at, of course, the Roman Catholic Diocese of St. George's in Grenada, you have a responsibility for, I believe, a vast majority of the homes on island. Before the pandemic, you've struggled with some issues that we spoke on background of. And so now that we're in that first wave, what was that impact like on the homes?
Well, first of all, we have 4 homes, and if I heard Ms. Thomas right, there are 13 in all. So
So
that's not the
thank you for that correction.
that's
Yes.
not the majority.
Yes.
But we have been hard hit, and I accept that as reality. In fact, the figures, I still think we don't know what the figures are, to be very frank. We have counted 14 deaths at Hilarion Home. 14 COVID deaths, COVID-related deaths, and 3 non-COVID related deaths. Now, the 3 non-COVID deaths are kind of normal for the process that you do, that you have in a senior citizen's home. But the 14 COVID, which first hit me as 8 deaths, that really was difficult to understand and to, But when I thought of what is happening in other places, I said to myself, well, this is what you have to deal with, so you have to deal with it. That whenever COVID hits seniors, especially in homes, it's going to run riot. We've had particular problems in terms of just assessing what was going on with staff and so on. Ms. Thomas did a very good rundown of the kinds of challenges that were there all along. Some of those challenges coming even before this wave, because I think all of last year, a lot of people don't realize that. I mean, all the homes were doing well. Grenada was doing well. And I was very pleased with the kind of attention that people were giving to the sick and the elderly. But once COVID struck, people panicked. And that for me was the main factor in what happened subsequently. Because people panicked. You have a lot of young people working in these homes. You have some people with children at home. So people just, I'm not going into that. That place becomes almost like a place of death. The home in Guav was affected much in that way because Guav was one of the early places where people saw this whole COVID pandemic coming to light, being experienced. So we've had a big problem with staffing. And Ms. Thomas is also very correct that the management, the toll on management, I mean, I had to go into the Hilarion home, and from the moment I met the manager there, I said to myself, she can't continue. She's a good person at heart, but she can't continue. And when you talk to me about vulnerability, and we were talking about the age of vulnerability, I immediately said to myself, it's not only the age to a vulnerable, the young people, the Imanis working in the homes, they're very vulnerable in this kind of context. And we have to be aware of that, not only for the homes, but I think generally speaking, the country hasn't really understood that the young are vulnerable in this situation. They're not troublemakers. We tend to see them as people giving the old people the virus. No, the young are vulnerable. And I've had to deal with 2 young people who told me that, they're having to stay up in the night with an old person, a senior citizen who is dying, and then to stand up at the door of a home, gate of a home, and watch a hearse, a funeral director, take out 2 or 3 bodies at one. That's difficult. That's very, very difficult. So we have all of those consequences to deal with and to evaluate.
Now, Bishop, how did we get here, though? Because during Grenada's first, and I'm going to raise this question with Ms. Thomas as well. During Grenada's first wave, well, not even the first wave, but last year when the pandemic was taking a toll on the rest of the international community, Grenada went into a lockdown period. But also during that time, Grenada made a conscious decision to ensure that there were going to be no visitors in the homes. And they were lauded for doing that. That's the Ministry of Health was lauded for ensuring that the seniors were protected. How did we get from a place where we made a conscious decision to protect seniors to a place where seniors were exposed in the way that they were exposed in this current wave, where protocols not being followed at the homes, that allowed that kind of wave to affect the elderly population as it did? Ms. Thomas, I'm going to start with you, and then I'll get Bishop Harvey to respond to that question.
Let me say We have continued assessment of all the homes in Grenada, Carriacou, and Puerto Martinique. We have an annual assessment we do that is based on the national standards for the protection, the care and protection of geriatric homes. In that assessment and that standards clearly give some directive for infectious control. We have some homes that has documented it because the standards clearly says that you need to have a plan for infectious control. It needs to be documented, posted. Your staff needs to know, need to be aware of it. And it gives some specifics. I don't have it with me. Isolation, having a room for isolation and all these things. But what we find, we've been working with the homes, making recommendations, putting persons in place who can work with the homes to get them where they have to be. But some of the homes sadly haven't reached that level. We have some of the homes who have developed that documented policy. They have a plan in place, and we have seen that these are the homes that have done better in COVID-19. So I just want to say that we have been working with the homes. We have a standard, we have assessment, and we will continue to work with the homes to ensure and to hope that all of them reach that standard.
So they're not at that standard yet, is what you're saying?
All of them aren't there.
Okay.
Yes.
And just to peel some more layers off this onion, when we say, what are those standards are we referencing?
Well, as I said, I do not have the assessment with me, but the assessment goes into details, safety, security, whether it's in nutrition. We normally have food and nutrition with us on the assessment. The assessment is about 9-10 members from different professionals calling according to the standards, whether it's fire, dealing with safety and so on, Ministry of Health and so on. The assessment have different areas. And we have some homes that as I said, are lacking behind in those assessment areas. They have things that they have to put in place. Like coming to the infectious control. Some homes tell you they have a plan and they will tell you that what they plan are, but it's not documented. It's not posted. It doesn't really have a direction. And we at the Ministry of Social Development, the desk of elderly, we have been giving them all the support we can to work with them for them to get at that point. At the standard level.
Bishop Harvey, same question to you. How did we get to this point? We are supposed to be protecting the most vulnerable of in the society. Yes, please proceed.
Well, first of all, Grenada got away, and I think we have to admit that. In March of last year, certain things were done, very strictly put in place, and Grenada got away. I don't know why we got away, but we got away. I'm clear about that now, because there were 1 or 2 occasions last year when it was felt, gosh, COVID is here, and somehow COVID wasn't there. In that context, the homes acted, well, first of all, the government moved very swiftly to lock down the whole thing. And a lot of people were calling earlier this year for that same action to take place. But I don't know what happened at the highest levels. My own perception is that economics trumped health, but where we found ourselves this year was that you had a situation where some of the things that were put in place last year were not put in place this year when the danger loomed. Just to give you one example, the transport of workers to and from homes. That was done very, very well last year. The government supplied transport for all the workers moving between homes. This year, when that was suggested as necessary, the government didn't have the money. Now, I can't fault them for that. But that, for me, was one gaping hole in the barriers that we set up. Because when you have people coming in to work in the home, and they're not assured of transport, they take whatever transport they can get. So we can't blame them when certain things happen as a result of that. And then there is the overall question, I think, in terms of things like budgeting and so on. How high on the ranking do we place the elderly when we come to talk about things like budgeting and so on? the homes need help. Our 4 homes, well, 3 of our 4 homes were started by foreigners. One of them depended very heavily on the support of foreigners. But the 3 priests who started these 3 homes are now all dead and gone. Now, nobody in Grenada has really stepped up to the plate in that regard. And we've had to look for overseas funding for that. So we have a lot of things happening, which we now, I think, one of the things that we have to do now is to really look again at what standards we want. I'm very happy to hear Ms. Thomas talking about standards, but those standards have to be looked at carefully, because it's one thing to have a list of things. It's another thing to train the people to do the work. And one of the things that I saw with my own eyes was that a lot of the people who are working in our homes, they don't have the appropriate training to do what needs to be done. And there too, you can't blame them. You have to blame us, for the fact that we haven't been able to discipline people enough to get that kind of work out of them. So we have a major task ahead of us, major task ahead of us.
Mm-hmm. Margaret Francis is making a comment here. She says, Bishop Harvey touched on a key point in relation to the caregivers of these homes, mental and emotional health during this period. But another issue that comes to mind is training. How equipped are these Imani young people to care for the elderly? Having worked in long-term care, this is not a population that you can have just anyone work with. I think, Ms. Thomas, that's squarely in your lap there, because I think she brought up the question of the Imani trainees. How does that work?
To be honest, the Imani program is not under our watch. It's under the Ministry of Youth, I believe. Mm-hmm. But the Imanis have, I think they have internal training period on whatever area they would like to go in. And I think when they are in the home, they are still under training. That's the other part of the training, the physical part of the training that they get from the home. So that is that they are expected to raise their level from the management and from the supervisors and older workers in the home to get that other level of training. So the Imani workers go into the home as trainees. They are there to train. So obviously they wouldn't be at the level that the senior workers are in. So it is expected that they will get there by having that type of training in the home. The ministry and the desk of the elderly do training at times for geriatric care training, but it is hoped that, and that is part of the assessment also. I do not know if Bishop ever had time to sit down and look at the standards. Each home has the standard. Mm-hmm. It talks about training, that each home provide training for their caregivers. So if it is that you want to have a training, or the home see that they want to have a training, they would probably organize and let us know. We would be able to send an individual or help them plan that training for the home. So as I said, it isn't, government can't do it alone. We need to work together. Yeah, Bishop?
Oh, yes. Listen, I am happy to hear you saying what you're saying, because especially, it was just yesterday, one of my managers was saying to me, that one of the issues here is that the Imanis are in training, but they do not see themselves as being in training. Many of them see themselves as having a work, to put it bluntly, right? And when you have that mindset about this is a job that I get because I know this person, I know that person, and therefore they give supervisors sometimes a lot of problems. So we have a serious problem there in terms of how much training are they open to. When the bottom fell out of the box, so to speak, at Hilarion, and the people who were supposed to be working or training at the home were not turning up, I had to turn to NULO, to the supervisor, the training instructor for geriatric care at NULO. And she turned up with a few of the people from NULO, the young people. And they were magnificent. You know, they were magnificent. But that is because they have a different mindset to the Imani who is coming in to be trained. So, you know, Kelon, this has wider implications from my perspective, because it raises questions about the whole question of youth, because Imani is under youth, right? So that when you put that on the youth and you are giving young people a sense of getting something and being trained and so on, when how much training they are getting, how much training they're open to is a big question. And I just think we have some serious problems to address.
And stick a pin here. I want to bring in Mr. Clifford John, who is a board member of the Grenada National Council of the Disabled, and Mr. Nicholas Snag. Now, in the conversation around COVID-19 impacts, we've been hearing from patients, we've been hearing from COVID survivors, we've been hearing from young people, we've been hearing from the homes and so on. But not a lot has been said about how this has been affecting Mr. John, can you hear us? I don't think Mr. John can. His connection seems to be having an issue there. We'll try and get back to him. But Mr. Snag, I would get to you. Expanding the lens a bit. Of course, you also work with seniors, but also in a slightly different capacity, retired people. But retired people experience some of the same vulnerabilities that people who are geriatric sufferers experience at the homes. So can you tell us how that has been impacting members of your constituency?
Well, Kelon, good morning to you and good morning to the listening public. And I am heartened by what I'm hearing here now. When I first heard the news of all the deaths in the homes, I weep for all those lost souls that we experienced so unfortunately. And to all the families, I want to extend to them my heartfelt condolences and offer them our support at GARP, whatever it is, just reach out. And to correct you, Kelon, we don't see it any differently from a retired person. Once you're an elderly in our community, you're part of our group, period. End of story. Yeah. What I'm really disheartening to hear is that there seems to be a complete lack of a national policy for the aged here in Grenada. And I think we need to get that going and get it going completely. Now, we heard that Bishop Harvey talked about training. We heard him talk about transportation. You hear him talk about housing. All of those things is collectively, from I recorded from my dearly departed Cara Vasquez. We had consultants with the desk of the Helity, the different ministries that we put together. They were working on a national policy on aging, and that's a lot of work went into that. A lot of work went into that, and it's a document that's there, and he spoke to all of those things. I think what we need to do is dust that off, get it on top of the pile, and start putting some action to this. Yeah, from what I'm hearing here, a geriatric person dealing with these people have to have a different mindset. They have to be empathetic. They have to be sympathized. You have to be caring. You cannot be somebody who's looking for a walk per se, placed in that type of environment. There should be some type of psychological assessment to see if that person is a good fit to be in that environment. Yeah, I am put back by that because I'm hearing Bishop Harvey spoke about the transportation issues, that all those little things that we did prior to this outbreak that we're currently having, and yet still we fell back and went back to with our comfort zone. Now, I'm glad to hear Bishop Harvey mention the youths, because the youths have a big part to play in this too. And I don't see them as the villain here. I see them as the helpers, the enablers here to get us moving again from this. Yeah, I see them as being the ones to go out and interact and to bring a sense of hope to the elderly in our community and to be able to do things for them. Do they need to go and get some shopping done? Do they need to get some medicine? Do they need to get some help just cleaning around, keeping around the home clean? Yeah, all those simple things that we take for granted, that not all of them have the advantage of having that done. But on the other hand, our young people have to take personal responsibility for their actions. Yeah? For instance, do you wear your mask properly? Do you sanitize your hand when you're moving about? How do you move about? Do you still gather up in groups? You understand what I'm saying? So that you are trying to minimize the spread as much as possible. At the same time, while you're trying to assist all of us in the community as we move forward. I really want to see us take the aging population of Grenada, which is quickly becoming the majority. I say within the next 5 to 10 years, they will be the majority because there are 20-25% of us right now are considered part of that community. So now is the time for government to start taking seriously responsibility. Now is the time for individuals, corporations, NGOs to start now putting the plans in place to see how best we can facilitate taking care of these people, making sure policies are in place for healthcare, transportation, geriatric care, financing, telemedicine. All of those type of things need to be collectively looked at to make sure that we are not letting these people left behind. Take, for instance, the theme of the digital equity for all ages. That speaks volumes. Now, you're a retired person and you cannot afford to have internet in your home. How do you do your banking? How do you interact with your friends, your neighbors, and everyone else? Can you afford to have a mobile device with access to for that purposes? All these things now start coming to play. So, that's what I'm saying. All the entities need to come. The NTRC needs to put some policies in place to say that we're going to make funds available to assist this vulnerable section of our society. Yeah. And believe it or not, a lot of the elderly people also have younger generations in the home that needs to go to school that is online. They need to get training. It's online. They need to interact with government. It's online. Yeah. So this is where the digital divide now broadens and become a big chasm. But I think if we collectively come together, we can definitely narrow that to a small gap that we can simply step over.
Let me see if I can get Brother Clifford again. Clifford, I think that there's some connectivity issues, but can you hear me? I still don't think he can hear us here. All right, so Bishop Harvey, I'm going to get to a question that has been thrown in your lap, but before I do, I believe you wanted to respond to what Nicholas was saying.
No, I was just absolutely well, not bowled over, but I really admired him as he was saying what he was saying, because I'm happy to know that somebody with those ideas is in the leadership of God, because what we need to do is to pull this thing together. I think COVID may seem like a disaster and all that, but every disaster on a national level has opportunities. And we have to be able to look at what is going on. And he did a really first-rate review of some of the things that need to be done. And especially to see people in homes, not as people in homes, but to see people in homes as part of that wider senior community of which retired persons are a part. It's not going to be easy to bring young people into it, but I think certainly the healthy retired and the seniors who are not that healthy can together work out things in certain areas.
Okay,
So
let's get yes, Bishop Harvey, and so we have a question from Brenda Batiste. She wants to hear from Bishop Harvey about the Catholic Church's governance of the homes. What is the role of the board? What about financing? They own the homes. His managers trained. Why has other homes fared better during this pandemic? I suspect she's referencing here fared better in terms of deaths.
I should expect.
Let's go there.
I should expect heavy questioning from Brenda. She's quite a powerful individual. Yes, the governance of the homes has been for some time very much left to the individual home. As I said earlier on, they were started by individual priests, Father Hilarion, Father Levy, and the St. Martin's home, Father Ed. And they had their own structure. As time wore on and these men either left the island or died, they came, because of church rules, under the general purview of the bishop. but they still had individual committees running. When I came, one of those committees collapsed, and I had to take over the St. Martin's home myself and ran it myself for a few months until I found the right manager. In the other two homes, the management has remained the same, but we began, because of what I saw in my stint at St. Martin's, I began to look more closely at the other homes. And just before COVID happened, we were able to say, hey, we've got to do X, Y, and Z. Okay, so we are now in the process of doing that. In terms of financing, the financing is a bit crazy because a lot of people don't want to pay what you need to pay to run a proper home. So we were fortunate to have some funding from overseas. But last year, when COVID began, I had arranged to have a group come down from the States, who, to be frank, I was hoping would have given us a few $100,000 to upgrade the homes and so on. But when COVID struck, that just disappeared. So we are now in a situation where the funding is a big problem. And how we will deal with that remains to be seen. But the accountability question, I'm happy to say that now we are really in place where that is clearly being worked through. And I'm clear that the buck stops by me for now. Whether the church can continue with that form of management of the homes remains to be seen. I have two managers now who are really very good at what they're doing, and we are looking for the right people to serve on management committees.
Mm-hmm. Someone is asking here, can the Vatican be called upon?
Oh my God. You know, that's a question which I hear all the time. To be quite frank, I just choose because people don't understand how the Catholic Church operates. The Vatican does not give you money just so, right? There are specific things. What people don't understand is that the Vatican itself runs in the red. So that the Vatican doesn't just give you money, right? The way you may get money if you have a specific project in mind, and then you ask for help with that. But the Vatican expects each local church to fund itself, right? And this is something which a lot of people here in Grenada have to move away from, because the Vatican is not sending me money. The Vatican is, I don't get a cent from the Vatican, right? In terms of, for myself, it doesn't send me money. If I have projects, we have catechetics and so on, I apply for donations. But even then, and this is an interesting point, that money doesn't come from the Vatican. The Vatican will contact, in our case here in Grenada, they will contact the church in Spain, if that church has some surplus, and ask them, can you help Grenada? So,
stick a pin, the church in Spain, what does the church in Spain have to do with the Vatican and Grenada? Can you just explain?
Oh, that's interesting.
Educate me, Bishop Harvey. I'm not an expert on
the Catholic Church is all over the world. The Catholic Church is all over the world, and therefore it has responsibilities. As a bishop, I'm one of 3,000 bishops running dioceses across the world. Now, most of those bishops in active service are in Africa and Latin America and Asia. Right? When I went to Rome for the first time, I was amazed at my African and Asian brothers. Now, the church in Europe, which is going down in numbers, is able, and in the US until recently, to fund particular projects in other parts of the world through something called the Pontifical Mission Societies. And what has happened more recently with Grenada is that we were twinned with the obras. Obras is the word for works in Spanish, in Spain. And they were giving us, the last time the figure was $60,000 EC, just to do some catechetical work, not for anything else.
Okay, all right, Bishop. Certainly, Ms. Thomas wanted to make a point here on policy, but I'm going to, Clifford, I'm going to see if we can get you back again. Are you able to respond to anything I'm saying now, Clifford? Clifford? Yeah, we still not we still not hearing you there. Yeah, Ms. Thomas, go ahead and make your point, please.
Okay. Earlier on, I think it's my friend Mr. Snag that spoke about
Yes.
policy, and well, as he said, we have done a lot of consultation on the policy. A lot of work has been done on policy for aging because we know it's important. The desk has been pushing for the policy, and we were hoping to have our policy in front of us by August, September, around now. So, but it seems that a lot of things is kind of because of COVID-19. A lot of things that we were working on is not coming through. So we are hoping that early 2022 we can have our policy with us. I just wanted to say that to Brother Snag.
Would that be budgeted for in the upcoming budget?
Yes, the policy for aging. We've had a budget before for the policy. So we are running on that budget. We've been working on the policy for years. Yeah. And also I want to speak to the bishop. He spoke about more support for the homes. And of course, we know that we have subvention. The government provides subvention for most of the home. Most of them subventions are monthly. I think one or two of them are quarterly. So they receive a financial subventions for the homes to operate. That is also one of the support that government gives to the geriatric homes. Yeah, just wanted to know that.
Oh, you just wanted to give us some clarification.
Yes.
Brother John, I keep trying to see if we can get you. Can you hear me now, brother?
I am hearing you. I'm not sure if you hear me.
Yes, let's see if we can work through this. If I can't hear you, what I'm going to do is I'm going to call you on WhatsApp because your contribution is extremely valuable. So let me do that, and I'm going to figure something out here in a second. Yeah. All right. I think we can hear you, Clifford. So you are here as a board member of the Grenada National Council of the Disabled. In this conversation, sometimes I feel as if the differently abled community tends to be excluded from these conversations on COVID-19. Media coverage has been very slim on this. And so that's why we felt it was important to highlight how this particular first wave has impacted your community. So can you tell us how COVID-19 has impacted this particularly vulnerable segment of Grenadian society?
Well, yes, that's right. I want to say thank you for the opportunity of being on your program and giving us as an organization an opportunity to speak on such. It's sad, and we want to take the opportunity to, extend our condolences to those that have lost their loved ones through this pandemic. It's very tedious, but at the end of the day, here we are, and it has impacted us greatly as an organization because not looking for such to take place. We know that there is a serious pandemic, but at the end of the day, it has impacted us very seriously. So a situation like this, and I welcome most of the other members on your panel because echoing some of the things that we need to actually put in place. And as an organization, we are just in the progress of trying to look at all avenues that we can actually curb to avoid from taking place. And but when we look at it, it's also an opportunity for us to work together as an organization, together with other organizations, that we can look and see how situation like this, we can work together to not maybe get 100%, but at least 85% of these things under control. And now is an opportunity, as you have brought it to light, is that when we look at your panelists and there's so many people involved, sometimes it's only when a situation like this, we know who are involved and who are responsible for something. So I think as an organization, we have to go back to the drawing board and look at the holistic thing of everything and see how we can connect with everybody and see what we can do before an incident take place. Because when the incident do take place, everybody is haywire trying to put things together, and we get left behind because everybody don't see the people that we see after, like the people that challenge us, no one, but they are entitled to everything else as everyone else when the time comes. So we as an organization have to pull ourselves together and see how we can work with the other institutions to make sure that we can be on par and also get our share at the end of the day and not being, go through what we are going through presently today. So it's as much as it's bad and we really take it at heart, but we have to go back to the drawing board as soon as possible to curb, because as a people, we always wait till something happens and then try to fix it. But we could also work on, before it happens, what can we do as an organization to make sure that we can stand and really work with the people that are challenged and the people that we are responsible for. Because there are many other organizations with us, and if we get them on board and we can be a body to reckon with, then I think in this situation, we can cover a lot of problems that we are already been facing, and hope that we will be able to cover it soon enough that we will not face the same problem that we already faced.
In terms of that material impact, have we had members of the differently able community that tested positive for COVID? I also know that, when thinking of differently able brothers and sisters, a lot of them take public transportation. And while reflecting on producing this program, I know that especially if you're blind, you touch things, you touch surfaces, right? And you also get on the bus, and you're touching surfaces in order to be able to function on a day-to-day basis. So, can you give us a sense of how that has impacted members, and how have you ensured that your members stay safe at this time?
That's right.
Go ahead, Clifford. Go ahead.
All right, I'm not hearing you, but I will answer. Well, in a situation like this, we are trying as an organization right now to these which are blind or visually impaired, that we could be able to transport them in certain areas without getting involved with the public because of the challenge. And this is something that we are working on, because one of the problems we are faced with our organization is that every year we have to change the board. And sometimes a particular board works on a good project, but when the next board comes, sometimes they don't see it as a viable project. So we are trying, we thank God that where I'm sitting presently, the members have given us an opportunity to run for 2 years, which COVID came in, and then we didn't have an AGM. So we have to be using the time in the meantime, because they have given us the extended before, hoping at the end of the year we can host our AGM, that we had sufficient time to look at all these things to see how can we move people from one area to the other without getting involved with the public. And as you rightly said, to be touching and to feeling to get us the way around. When we look at times like this, if we have a transportation and a driver, then we could be able to say, okay, this person can call us and we can respond as much as possible. Because these people going on the buses, there is no one to really take care of them. And our society is a type of society that the minute time you're blind, they say, why don't you stay home? But we encourage people, not because you're blind, you cannot be able to move or to go elsewhere, because they are training and help you to get along like that. So we are looking from an organization, what can we do to curb, to work on something that we could be able to assist people when situations like this, that they would not be able to become more vulnerable than they are, to get themselves involved in situations like this. Even sometimes medication or getting to the doctor, it is so difficult because these people have underlying issues and they need more attention than the normal man. They can't stand in the lines, or they can't, be able to do things on their own. So we are trying as an organization, because we are given an extension of time to look at what we're doing, and these are one of the things on the table, seeing how we can get a vehicle that is accessible to people with disabilities. So we can take the people with wheelchairs, those that are blind, and all the others, so we can work with them to take them to the places that they need to go. Even sometimes just going to shop, because some people want to go and shop on their own because they are blind. But at the end of the day, we can assist them with the necessary tools to do such and would not hinder their health.
Clifford, thank you for that. And you've raised some very salient points here with respect to how we should be caring for our disabled brothers and sisters. But folks, at this juncture, we would take a quick break. And when I come back, I want to really switch gears a little bit to get into a conversation about just a culture of neglect, whether that is an anecdotal observation or whether that is embedded into the culture of Caribbean societies. And that has to do with the way that we treat our seniors, and whether or not this particular pandemic has really exposed that culture of neglect that some perceive to be a significant problem in Grenadian society and in Caribbean society in general. So we will take a quick break and we will be right back. Since losing that seat, what have you been up to?
Now, Mr. Attorney General, this particular provision sounds unconstitutional.
But why were there not consultations before moving forward with the proposals? Did they say what will happen when you guys get to St. Vincent? Because there are pressing social economic issues that I would want to address with you. In the hyper-information age of social media, the Bubb Report knows there is more to the story. We have questions and demand answers. We strive to hold the powerful accountable and tell an unbiased, contextual story. You know what happened. We let you know why it happened. There is always more to the story. The Bubb Report, streaming every Sunday at 11 a.m. on Facebook and YouTube.
So it's not a legal schooling. I know you're sensitive to people schooling you on the law, but I think I can trump you when it comes to the history of Grenada.
What you're saying is that this resignation was expected? Would it be fair to say that you abdicated your responsibility by not showing up in Parliament on Friday?
We are not aware of the terms of the agreement.
But then how can you say the terms are not favorable? You don't know the terms.
You know, we love our talk, we love gossip, we love brango, we love all them kind of things in the Caribbean.
If I cannot play music, I don't know how I'm gonna live.
We are borrowing money to pay debt because of corruption, waste, and mismanagement.
That they have difficulty with your leadership. Why then are you contesting the presidency? You said. Welcome back, folks. And before I get to back to the panel, I just want to share a virtual event that will be happening later this afternoon. Let me see if I can pull up this this particular flyer here. And it is a COVID-19 a mental health awareness virtual panel. Ask the Therapist, Mental Health and You during COVID-19. It will be aired on the Facebook page of the Office of Diaspora Affairs, as well as on the Facebook page of the Grenada Broadcasting Network. And that is happening today from 5 p.m. Of course, the mental health impact of COVID-19 is significant, and it is an issue that we also need to ventilate during this period. The panelists, Shane Joseph, who is a social worker and psychotherapist, Althea Kador, a registered psychotherapist, and Dr. Leo Edwards, who is an adult clinical therapist. Both Mr. Joseph and Dr. Edwards are Grenadian expats in the Toronto area. So if you have time this evening, definitely check this out. All right, panelists, let me bring you back. And Mr. Snag, I will start with you for this particular conversation, because I know that Carol Vasquez was very passionate, the deceased, may her soul rest in peace. Carol Vasquez was very passionate about what I said earlier and teeing up this conversation here about that culture of neglect. On background, when I had conversation with Bishop Harvey, he also intimated to those ideas of culture of neglect. And it's one thing to have policies in place, but it's another thing to also discuss culture. And so I want to hear from you. Is there a culture of neglect of our seniors?
Yes, there is, and it's a sad part of our society that needs to be addressed. We at GARP experience it all the time, unfortunately. And I'm not saying it nonchalantly, because every time it comes to us, it tugs at us as an individual to realize this is somebody's mother, this is somebody's father, this is somebody's auntie, this is and why are they being treated that way? It's wrenching for me personally, because we just experienced it recently, where we had to step in and do what we do, to assist that individual and get them back on their footing. I don't know why the society does that. I'm not sure if it's a matter of not having the coping skills to deal with it. Some of these elderly people are dealing with a number of things, health issues, psychological issues. They're going through dementia and all kinds of things. And dementia is another growing problem that we have on the horizon. And it's like a ship sailing in. It's getting bigger and bigger and bigger on the horizon, and we're still not paying attention to it. Whereby these people can be very disruptive in behavior, in speech, in attitudes and everything else. You might have this sweet auntie that you knew all your life. All of a sudden, this person just switch and become very abusive verbally, even physically. Yeah. And you have to deal with that. If you're not capable and ready to deal with that, it can be quite a strain on you as an individual, a caregiver, and the family. So you may take the order as well. You know what? I'm going to leave you in the corner here and have you behave yourself till you learn to behave yourself. Listen, that person is not going to learn to behave yourself. We have to adapt and try and help them as much as possible. And I've said in other programs that we all know who these individuals are in our community. What we need to do is I'm taking a page out of Bishop Harvey's book, is to love our neighbors as ourselves and reach out to that individual. No matter what they say, no matter what they do, you know they need help. Let us find a way to get to them the help that they need. And let's not stay on the wait side and wait for somebody else to come and do it. No, there's not somebody else. It's you. You are there. Do something. If you need help, reach out to someone else. Go to your neighbor and say, watch, I'm really trying to help Auntie John down there, but she's resisting me. I know you have a good relationship with her. Let's talk. Let's go and talk to her, see what she needs. Mm-hmm. Let's see what we can put together to help her. Yeah, to get over this rough spot. And Ms. Thomas, I hear you and I appreciate you. And I know we work very hard together to get us to this point where we are with this policy. But Ms. Thomas, we need the policy to put the laws, the strength, the teeth, the vigor into it so that we can get things moving. I mean, for you alone on your staff need to, at least to me, needs to double just to deal with what it is. And it's still not enough, correct? So with this, what I'm saying is a collective things we need to do. We cannot be individual. We cannot sit in a silo and be a king of this silo while everything else around you is falling apart. We need to come together. All NGOs, all agencies need to come together and work on this issue. COVID, as you well say, a lot of things we get swept under the rug. COVID has come and ripped the rug out. So everything is there in everybody's eyes. Yeah. And to me, sometimes when you look at it, it's so overwhelming. But it comes back to old African proverbs. How do you eat an elephant? One bite at a time. Let's take something and tackle it, get it functioning to a level where it can be self-sustaining and move forward. Bishop Harvey and the homes, I had an individual reach out to me to say they're willing to help a home as a business on a monthly recurring basis. So, but she has some stipulation that she's want to be able to be met. And we have to have that conversation after we get off this program. I am thinking we can do different things. I'm a salesman, and I always tell my young people coming after me, I would rather have 10 accounts pay me $100 than to have one account pay me $1,000, because that one account, I have to circle all my energy around that one guy. Yeah. So let's look and see how many corporations, how many individuals we can get together that is of same mind and willing to make an effort to contribute to assisting these homes, whether it be a farmer cooperative that can produce some produce, healthy foods, a fishing cooperative that can produce some fish on a monthly basis allotted towards the homes, the chicken farmers, the you name it, they're out there. And maybe they are willing to do some things to assist, because let's get real. All of us are racing to the end, which is going to be some point in time, we're going to be aged. Some point in time, we're going to need some assistance from somebody. Yeah, let us take the time now and put all these things in place. So when we get there, we can reap the benefits of this fruit. Yeah, do the work in the vineyard now. Yeah. So when the time comes to harvest, we can be enjoying that harvest too, and encourage the young people in the same way too, that they get involved with these type of things. And, you know, in Time CC, there should be a program dedicated toward geriatric care and get educating people for this. You can be an entrepreneur of your own ambition doing these type of things. You have 10, 15, 20 clients that can pay you to come to them and to do things for them. Yeah, this is a huge industry in the United States and Canada and England and all those places. It is $1 billion industry where these individuals, all they do is go to these homes, make sure that person is taken care of, cook the meals, some light cleaning of their premises, these things, but you have to be in a total mindset. You have to be able to deal with the situation you have. And coming back again to the national policy. So when you recognize something is going wrong, you have some place you can go and report it and says, listen, Miss Jane at so-and-so is having an issue. We need to get some further assistance here. We need to get a doctor visit or nurse visit or a psychologist or somebody to pay a little bit more attention to this individual. Yeah. So once we start getting these holistic thing, we cannot look at it as individuals any longer. It's gone way beyond that.
Mm-hmm. And Bishop Harvey, I would get to you again, speaking of the culture of neglect on background. Well, let me just say that obviously I was trying to get you on the Bubb Report for some time, but you finally made it. But when we were having some of our background conversations, you spoke about that culture of neglect that exists in some of the retirement homes in Grenada, where some families, would just leave their relatives there, and nobody comes back to see them. I mean, as a point of personal reflection, whenever I visit Grenada, I make it my duty to go back into the communities and to visit our elderlies, our senior citizens, because to me, every senior citizen is a library. Every senior citizen has a wealth of cultural and historical and institutional knowledge that they can pass on. And I get very passionate about this because I was raised by old people, by senior citizens. I don't like to say old people, but I was raised by senior citizens, right? And they had a significant impact on my life. Okay, and that is something I'm very passionate about. But over to you, Bishop Harvey.
Yes, and first of all, I want to honor the memory of Carol Vasquez. I'm very happy she has come up on this program. I only met her twice, but when I did meet her, she made a tremendous impression out of two things: her commitment and her vision. And I must say that my fellow panelist, is Nicholas, is really echoing a lot of the kind of things that I would associate with somebody like her. So thanks for keeping that alive, Mr. Snacks. Now, with regard to the culture of neglect, yes. I've been struck by one thing with that, and it really has been very difficult to digest. What I sense in Grenada is that culture of neglect is accepted by the elderly. It amazes me how people have become so accustomed to being neglected that they really don't want you to take them anywhere beyond that neglect. And I don't think it's just dementia. I think it's something that has become part of the culture. A man died just in a house just below my own house. And the sisters, Mother Teresa's sisters and myself had tried to reach out to him. I used to take him breakfast and lunch. And then one day he just said to me, I don't want that anymore. And I wondered about why. And when we did get to a little chat about it, I realized he felt I was getting too close. He didn't deserve that, And I wondered for a while whether it was because I was a bishop, I was the bishop. So I asked my cook to work in that regard, but then it continued. And I'm seeing that on the streets of Grenada. One group of people that we are forgetting almost completely is the street people here who are walking the streets, who go for lunch by the missionaries of charity and they get a meal there, And if they might have one or two other places where they get meals. But they have, when you talk with them, they have family in the country, When I first came to Grenada, I said Grenadians should never starve because they always have somebody to go by in the country. But these are people who are not going anywhere. They are here in St. George's, they're walking the streets, and they are carrying in themselves that culture of neglect. They've accepted it, they've taken it as part of their life. And all that we have been talking about here is good, but how do you get into the psyche of people? How do you get into our young people's heads? What was being said about getting the young people at TAMCC and so on. That's a very, very difficult thing to do. And my own sense more and more is that Grenada and the whole Caribbean in the light of COVID need a period of social and political imagination, reimagining of the kind of society we want, reimagining of where people fit. What do we want to educate our young people for? We are still on this certification mode, right? With our older citizens, what do we want for them? We have had to look in our homes very much more closely with the employees at a culture was a culture of sit down and watch. So you make sure they have their lunch or their meal, and then you just sit down and watch them. You don't engage them as human beings, and that requires training. So the culture of neglect is not only about neglecting them in their old age. It's a question of the ways in which we can neglect them right now on the streets of St. George's, right now in the very homes where they're supposed to be taken care of, where the deeper question of, am I really seeing this as another human being, whether they are disabled or just suffering from dementia and so on? Are we seeing them as a problem to be solved?
Mm-hmm. Mm-hmm. And Ms. Thomas, I'm going to bring you in here on the same question.
Well, of course, we have been dealing with that a lot of years. We have been speaking to it. I think we were once a country, communities were very family oriented. I believe that. I have seen that. And we still have some of that. However, families tend to believe now that taking care of their loved ones is someone else's responsibility. It is a government responsibility. And they find all reasons to make it not their responsibility. Hence, we have the geriatric caregivers program that was born. The program has probably about approximately 50 plus caregivers and imanis that goes into homes and give daily care for older persons living at home. And the program has its criteria. It is for persons who live alone, don't have anyone else to care for them. But we find that persons are living with their families, and the persons in the program still has to go in to provide care because the families have their loved ones in the home and they are not looking after them. So yes, this is a problem. Or someone spoke about Alzheimer's and dementia. When that happens, families tend to neglect their loved ones. And we say to families, if it is that you need assistance, the Ministry of Social Development and the government is willing to work with you to give you an assistance. But it is so important when you have family members showing that love and that care for older persons to live a fulfilled life. When you have persons on the outside, caregivers and so, yes, they will go in and they will do their part. But having a loved one, having a relative that show love and support is so important. So our society has moved out from family oriented, and we start to believe, as I said, that taking care of older persons is someone else's responsibility. Even our community love and togetherness are also going out. We have the community used to look after the community. We don't have that anymore. We say to persons, especially in this COVID time, you might hear of someone that live alone. You haven't seen them out for a day or two. Make a call. So we have gotten into our shell and everybody is for themselves. But we keep asking persons to show some love, look out for the older persons. Family have a responsibility to look after the older persons. It is their responsibility. That's the first responsibility before it comes to government or the community. So we're asking persons to show them some love, continue to care and show love for our older persons because it is a big problem in Grenada.
We will be wrapping up this segment in short order. But before we do, and I have Mr. Kenny James in wait here. Mr. James, thank you so much for being so patient on this Sunday. I know it's way into your lunchtime, so thank you for staying with us. The next segment, we would be paying tribute to some of the teachers recently deceased in Grenada. with Brother James. But Bishop, I have some questions for you, which are not necessarily related to this morning's topic, but one of them has to do with the Catholic Church's position, or I should say, on vaccinations. I know that, for example, Pope Francis has said that vaccinations is the way to go, right? And however, I do not know that there is a universal message from the church. The Catholic Church is supposed to be a universal church, so one would think that the messages would be universal. Again, I'm no theologian, but I want you to clarify your church's position on vaccinations. The context of my question is one of your parish priests, Father Gerard Paul, in a sermon touted anti-vax sentiments, right, from the pulpit. People listen to their priests. Parishioners listen to their priests. So I needed to clarify that because I do not get a sense that you did. So I want to hear from you, please.
Yeah, well, first of all, the church is a universal institution, yes, but it is a church that believes in unity and diversity. And therefore, on a number of questions, you will have that leeway for a variety of opinions. And on a lot of health questions, that is the way that the church functions. So when it comes to something like vaccination, the right of individual conscience, right, remains supreme unless you see that this is really a threat to the common good. If I am exercising my individual right in a way that endangers the lives of others, then there is a problem. I think with the whole vaccination issue, the people talk about vaccinations as if it's the answer to the problem, that if we all get vaccinated, we'll be okay. My personal view is I have been vaccinated and I will encourage people to get vaccinated. But I'm very conscious of the fact that there's a lot about vaccines that we do not yet know. And I am encouraging older people to get vaccinated, but I'm very cautious about the younger people, the children. When we talk about children 12 to 18 and so on, I am very cautious about that. So I am not going to say to a parent that you must get your child vaccinated in the same way that I would say to the parent that you have a moral obligation to get vaccinated. I think we are rushing. We live in an instant era where everything must happen now. So a pandemic comes, you must get rid of it now. And that's not the way pandemics have operated in the past. We know enough about the history of pandemics. So it takes 2 years to get a hold on a pandemic. So to get back to your main question, the official position of the church as articulated by the Pope is that people should get vaccinated as an act of Christian charity. There are some people who say, no, they're not getting vaccinated. Some people believe the conspiracy theories, and Father Paul is one of those who believes in the conspiracy theories. I can't put something in his head.
You are, however, the bishop of St. George's.
Yes, but the understanding of being a bishop, Kelon, is very different now than it was 30, 40 years ago. Right? 30, 40 years ago, you could suspend a priest until he changed his ways. But when you have a situation where the science itself, that he could turn to various things and say, this is still unclear, I can't force it. I can't force it.
Okay. But we know what your position is.
Yeah, the official position is get vaccinated. For adults, parents have to make a prudential judgment about their own children. Right.
Yes, and the final question I had before we get to the rest of the panel for closing comments, because we're quickly running out of time. This
you
has
better
been
call me
such.
back.
I will, Bishop. I will be calling you back. Rest assured. We have some conversations to have on social issues. You will be back, I assure you. But that has to do with the renaming of some of the schools. A circular has been recently released by the Ministry of Education that puts a lot of the Catholic schools in line with their saint names, I believe. There has been some concern. Obviously, that might be a storm in a teacup, of course, but there's been some concern that by renaming the schools strictly according to those saint names, you are decoupling them from their community associations. So, for example, the St. Joseph's RC School, the Pomerose School that I attended, it's affectionately known as Pomerose RC, yes? Correct? But I know that this has been a recent circular, but I know that this is a conversation that has been happening before. So I just want to get some clarification from you, sir, with respect to what was the thinking behind that decision.
Well, I was surprised myself when I saw the notification the other day. Somebody had mentioned to me that it was being done, and I just said, well, I don't know anything about that. And then the other day, I did see an actual notice to that effect. What I now understand is that several years ago, a request was made for that change. Several years ago, I suspect during the tenure of Bishop Vincent Darius. Nothing was done about it. Nothing was done. And now all of a sudden, with no reference whatsoever to the change of leadership in the church, this thing is done at cabinet level and just presented to me. Now we have to make a judgment of whether we have time to waste on that or not. If the communities are facing a question of decoupling, now that's interesting, because right now I want my schools to feel more and more in their communities. I'm making that very clear. The schools have an obligation to live with the community. That's the only way that we're going to really be able to have the kind of education system which is a partnership between church, parents, and government. So we have to keep that. So what you just said to me now opened up for me another thing, and that is that although it may be a waste of time to try to get that change back, unless you understand why the original thing was done, there must have been some reason for that original thing being done, and we have to research that. I would really like to think that St. Joseph RC will always be St. Joseph's RC Pomerose, because you have St. Joseph RC Montjalou, and that's the kind of confusions that are going to come from this. So I think we have to think it through. The main precept, which you yourself just articulated, is the church schools must remain community schools. They must never become institutions away from their communities. And how best we do that is something we're going to have to work on.
Well, Bishop, I'm glad both of us agree on that, because that raised some eyebrows for me. And let's get to some comments here quickly, and then we'll get to closing thoughts from the panel. Margaret Francis saying, Bishop Harvey, I went to Montjalou School, my mother too, and all my uncle and them. I can't get used to St. Joseph's RC. So it will be Montjalou RC for me for life.
Amen.
Somebody saying, was the people in the Hilarion home vaccinated?
Some were and some were not, because the vaccination question was a question of whether those responsible for them agreed to their vaccination.
When you say those responsible for them agreed to their vaccination, please
clarify.
Well,
every person coming into the home comes into the home with somebody responsible for them, unless that person has failed to show up over a period of time. There are people who pay whatever is the monthly due for them and so on. So the homes were instructed before any vaccination was done, you have to get in contact with whoever is responsible for them and make sure that they know that the vaccination is being offered on such and such a day. In one or two instances, the person said, that person is conscious enough, they're aware enough, let them make the decision. Okay. So it was a question of being sure that you were not violating anybody's personal rights.
So you made it a choice. It was a policy of choice.
Oh yes, oh yes. I'm totally against with senior citizens. We can't just act on them as if they can be experiments.
Lydia Thomas, what was the policy at the government homes with respect to vaccination, or what is the policy rather?
Oh, that's the same response Bishop gave. If it is that the persons can make a decision for themselves, they are not in dementia and there's no Alzheimer's, that they want to take the vaccine, that's okay. But also you have to have a conversation with the person that's responsible for them, that person that signed and brought them in, that person that's responsible, the first person to call. You have to have agreement that they agree for their loved one to take the vaccination. Yeah, that's the same.
So that is the policy. Okay. All right. Let's get to some closing comments. Brother Snag, I'm going to start with you. Just put a bow on everything, and then I'll go to Brother John, and then I'll get back to the Bishop and Miss Thomas. So Snag.
Well, Killer, and I really appreciate it. I like to stay on the positive side. Yeah, there's lots of positive coming out of COVID. It's not all doom and gloom. I don't want everybody to walk away saying, "Oh, it is so bad." No, it is not. There is some real good opportunities here for us to learn and come out of this on a brighter, better place. Yeah, I want us to stay positive, stay grounded. If you happen to get in contact with COVID and you have been tested positive, there's lots of things you can do to help yourself. Yeah. You said you grew up with older people, so you know all the remedies, the bushes, the herbs, and all of those things you can do to help yourself. Yeah. Get proper rest, get the liquids in you, get some sunshine, get some activity. And the one thing COVID like is for you to lie down in a bed. Once you hit that bed, that's when he likes you the best. So stay away from the bed, get up and be active. Yeah. And together, I think we can do a lot of things together. We cannot sit in our own little silos and think we can do it all. Otherwise, you cannot eat the whole elephant with one bite. Everybody has to do their part. I'm calling for us to come together as a society in this time and look out for each other. Let us be our neighbor's keeper. Yeah. Let us look out for the elderly specifically. Yeah. Let us all collectively, businesses, private, public, NGOs, all those people, community group, organizations, Fisher group, church groups, everybody come together and let us do whatever we can. Every little bit counts. Let us look out for each other in this time now. Let us be caring about each other at this time now. Let us, the neglected, let us pay attention to them. A kind word. It's something to eat, something to drink, just a conversation. And you can do that 6 feet apart, and you can do that with a mask on. You don't have to be on mask. You don't have to be right in the person's face. You can still have that conversation, that interaction with people. And to my Miss Thomas, we are here with you. You know that, and we're supporting you 100%. And we at GARP, part of our mission statement is advocacy for the rights and the betterment of the elderly, right? That's our mandate. This is part of our mission statement. So I must speak to that because the policies and everything that we do now is going to happen 2, 3, 5, 6, 10 years, long after I am gone from GARP, long after I'm gone from departed from this earth. And it has to be done. And let us take the time now to do it so that we can have a better future for all of us, young as well as the age at this point.
Mr. John? Clifford, can you hear us? Clifford, over to you for some closing comments. Okay, we seem to be having a delay there. I'll try and get back. If you heard me, just yes, go ahead. Clifford, your audio is really bad, so we would be doing a follow-up conversation with you on that. But I want to get to Ms. Lydia Thomas for some closing comments.
Okay. Well, I agree with Brother Snad that all what has happened, we of course have to learn from it, and no one can do it alone. We must come together. The desk has been working together with GAP and some of the other NGOs to provide proper care and so for older persons. The ones that we have lost, we are saddened by it. And as I said before, we have to take a pity going forward. The Ministry of Social Development and the Desk of the Elderly continue to support our geriatric homes and our older persons out there. We continue to supply our PPEs, to our homes. We continue to give psychosocial support, and we are now, we just started giving some psychosocial support to relatives in the homes who have lost loved ones from COVID-19. So as we said, going forward, we will continue to work together to combat this disease, and we hope and pray that all of this will be over soon and we'll get back to our everyday lives.
And over to you, Bishop Harvey.
Yes. Well, thanks. First of all, I want to thank you, Kellon, for putting this together. I have really, well, enjoyed might not be the best word, but I have been very moved and I think even activated by what I've shared here. And I want to assure Mr. Snaggs that we will be able to work together on a number of things as we've been working with the deaths of the elderly and so on. I think the one thing that we really need at this point in time is to move Grenada beyond the divisions. One of the things that I feel very strongly about is that education and health must not be things that divide us. We must be able to come together and agree on what is the best strategy for certain things, certain areas of our lives, especially these two, and really put our shoulders to the wheel to get the thing done. So for the present, I thank God for COVID. I hope people don't feel that I'm being foolish, but I thank God for the ways in which COVID has opened eyes. It's opened my eyes and opened the eyes of a lot of other people. But it is easy for us to just simply look at what is happening and complain. And I have to thank God and thank those who have been positive even on this program in terms of saying this is what we can do and this is what is good and so on. Let's take the positives and run with it. COVID positive may be bad for us, but positive action will be good for us in the struggle we still have to face. Thank you.
Thank you, Bishop Harvey. Bishop Harvey, the Roman Catholic Bishop of the Diocese of St. George's in Grenada. Panel, thank you all. It's your lunchtime now, and so we want to thank you again for really, I believe this was a very revealing segment. This segment revealed more than it concealed. And so I think these are conversations that we need to continue to have. But our vulnerable population, they have a critical voice, and we need to highlight the challenges that they are confronting. Stay with us, folks. We'll come back for final panel of the day with Mr. Kenny James, who is standing in wait here, sitting in wait. Brother James, thank you for agreeing to appear on the program on such short notice. We will be right back.
COVID-19 and integrated care for older adults. Older adult-centered service is a criteria for efficient intervention. During the COVID-19 pandemic, the older adult must be an active part of the design and implementation of their care plan. The usual health needs of older people are added to those of the pandemic. Face masks, strategies to maintain proper physical activity and adequate nutrition during physical distancing, management of their chronic medication, and access to adequate information and support strategies for mental health. The perspectives of older adults must be respected in healthcare during this pandemic. Therefore, it is important that they have access to information and strategies so they can make the best decisions. Healthcare should not solely be focused on COVID-19, but rather on the older adult. This means focusing on their intrinsic capacity, taking into account their autonomy in the establishment of therapeutic and care plans without losing sight of their functional ability. Access and continuity of adequate pharmacological and non-pharmacological treatments for the elderly during physical distancing constitutes one of the main challenges during this health emergency. This is particularly important for older adults who live dependently on caregivers, including those in long-term care institutions, which have been extremely harmed by the epidemic, with extremely high mortality rates even in highly developed countries.
And welcome back, folks. I'm happy to be joined by my final guest of the day, Mr. Kenny James. You are an avid watcher of the Bubb Report, as I understand it. And so we thank you for always being engaged with what we do here on this platform. But Mr. James, I brought you in here because, of course, we'll be celebrating World Teachers Day early this week on Tuesday. But this is a moment for also somber reflection for the teaching community in Grenada, which has experienced some significant loss. So I want to open by giving you an opportunity to acknowledge some of those losses that we had over the last month.
Thank you, Dr. Bubb. Brother
Yes.
Kellogg. It's a pleasure to join you on the report this morning and, of course, this afternoon, to speak about teachers and what is happening. As you did mention when you started the program, you extended condolences to the family of Sister Patrice. And indeed, the teaching fraternity has been hit hard by some serious losses. We've had recently Sister Patrice. You also did a program on former principal of the Shaper, that's Brother George Wilson. He passed. We have lost Sister Claudine Nichols from the Boca Secondary, who was just going into her retirement. She has served well and avid supporter of the union and so on. So some tremendous losses. Sister Sandy from the SDA in St. George's, and retired teacher to Comrade Austin Lewis from St. Patrick SDA, again, someone who, once you would have engaged him, you know he was a serious guy. Came to conference, spoke his mind, was passionate, delivered well. So we have seen and suffered some loss in the teaching profession. Good educators, whether present or retired, and the Grenada Union of Teachers some time ago had that foresight to establish the Retired Teachers Association. So even our teachers who are retired, like Brother George, Sister Patrice, they're still part of the teacher family, the GUT family in Grenada. So indeed, we want to say condolences to their families, to their schools, and we hope that we would not lose any more teachers. As a matter of fact, we don't want to lose any of our resources in the country. So we're hoping that this is going to die down slowly and that we'll recover successfully in this period. There are teachers who may not have suffered the loss of their loved ones, but they are battling infections. Personal infections. I mean, a number of teachers that I know have been infected. And apart from the teacher himself or herself, there's the family situation where you are dealing with infected persons in your family and treating for them and with them. So there's a whole set of dynamics at play here, but we're hoping and praying for the best for all teachers.
As a point of clarification, Sister Patrice did not die from COVID-19, but of other complications. We needed to clarify that's my former teacher, Mrs. Patrice. But going
very well, but it's still a loss to us.
It's still a loss
Yes,
to yes, it's still a loss. Yes, absolutely. Going into World Teachers Day this year, reflecting on the struggles of educators in Grenada and in the developing world. What are your thoughts on how teachers can navigate this particular challenging period in world history?
Kelani, the theme set out by UNESCO is very instructive. Teachers at the heart of education recovery.
Mm-hmm.
Because across the world, we know education has been hit and hit hard. We, in our local context, we are faced with a number of challenges, from devices at the level of the teacher. Thanks to the ministry, teachers have been given some devices. However, there's still some challenges in terms of what you can do with some of them. We have to look at our students. The fact that you have a situation in some homes where the parent's cell phone is what is being used. So here you have a parent having to go to work, may need to be in contact with other people to get things done, but has to leave the cell phone home for the child to be able to engage with school. You have a situation where some may not have device, because there's still some bit of inequity, if you want to call it that, in this entire thing. Not every child has access. We tend to think that, okay, we're living in the modern age, and so everybody has. But that is not a true statement. Not everybody has, and not everybody has the access. So we have that to deal with. We have the instability of the internet. We have the frustration faced by the teacher as he or she attempts to cope with his personal situation, his family situation. Added to that, there's a psychological thing that is happening, which I call now the teacher cabin fever. Because you're teaching from home, for those of us at the secondary level, we engage from about 7:45, 8 o'clock to 2:30, 3 o'clock. But then Tong and the businesses are closing in time for 5 o'clock. For the curfew, for example, on Friday at 5 o'clock, which we've experienced for the lockdown weekends. Or the fact is, you cannot really leave home to go and just relax as you would have done if you were actually in the workplace on the school plant. There's a transition, because you go to work, you teach, and then you kind of disengage from the schoolhouse, and you move, you go on the bus, you drive, you engage with people. So psychologically, there's a change, there's a transformation. Even if when you get home later, you'll get back into some schoolwork. But now you are home, and if you don't make a conscious effort to detach your teaching and your teaching position in the house from the rest of your life, there's some psychological things taking place there. So I call it the teacher cabin fever. We have that. We have the exploring of platforms and how to use them. Because, Kellan, one of the things is this: Teachers College didn't teach us how to deal with this situation. This is a situation that came upon us. We have some foundation in terms of teaching strategies and how to engage. There are those of us who would have, in our higher education, graduate work, would have engaged in the blended approach. And so we know a little bit about how to deal with it. But actually to implement it at the kindergarten level, at the primary level, at the secondary level, it is posing a challenge. So with all of these challenges around us, we are in a place where teachers are now rethinking approaches, teachers are now exploring approaches, and also in all of that, doing our best to keep our students engaged, trying to make sure that while we're home, that we create a semblance of normalcy for the students who are also at home. So in many of our schools, in the morning, please the Lord, you would have the morning assembly, Monday morning assembly, which is taking place on Zoom, whether it's whole school or lower school and upper school, you have that engagement. Some would break out into their form rooms for registration. right? So that kind of thing is different. It's new, and it's not going to change. What am I saying? This blended approach to learning. Remember, education, as we always say, is a dynamic process.
Mm-hmm.
And so we're not going to go back on this change, but we'll continue to see improvement in it. So right now we could say it's an exciting time. The system is evolving. And as it continues to move, our teachers would continue to see what they can do, how we can propel this thing forward, and how we could get acclimatized to the new situation that we're able to deliver, and that our students, that whole teaching and learning engagement, that it remains meaningful.
Mm-hmm. And innovation, I think one of the things that has happened with COVID is that it has forced us to innovate.
Yes.
And things that were shelved has now become a matter of immediacy and urgency. There is no choice, but you have to implement those.
You have to. You have to.
Yes, so I'll give you the floor for some closing comments because we're almost out of time, but I would cede to you for some closing comments today.
Kellon, I want to encourage our students, first of all, to remain focused. This is different. This is new. But we can make it. You can make it. It's going to take a little more from you. It's going to take some time in some cases, but you are going to get it. We know that your manipulation of the devices when you are on Facebook and social media is different to when you have to engage in your Google Classroom and on Zoom and so on. But be patient, you are going to make it. Parents, you have a responsibility also to ensure that you keep monitoring your children. You go to work, you leave them home, and there's an expectation that they would go online. You need to follow up, be it to communicate with the school to find out whether your child has been showing up for online classes, what has been happening. You need to monitor. There are things that you may not know, because while we teach, many of you are in the background and you're being taught. So there are things you may not know, you may not understand. That is all right. We would do the clarifying, we would do the reteaching where necessary. What we need from you is to ensure that you're offering that support. Now, in many instances, many schools have requested that the children turn on their cameras, at least at some point in the engagement. And this is so that we could make sure that it is our child, our student who's behind the camera.
Or that the student is present.
That's right. Because registration is taken. So a word to some of our parents, we know that the living conditions of everybody is not the same. But you can maybe get a sheet and place over, just pin it up on some wall and position the camera in such a way that all we see when we ask that child to put on his or her camera is the white background. That is all right. Right? So you could set it up in such a way that you can help to facilitate that. And so we need your support in this regard. Also remember, they're not robots. There's a psychological change that's happening. The eyes, some of them, their eyes would burn them because it's the screen time is something new. The amount of time that is spent engaging on the screen is different. So we need your support here. So our teachers.
And there are two comments that just came in. Neela George is asking, how are differently abled kids helped? That's one question. And Kimberly Phillip is asking, but thinking about inequities, class and access, we need to ensure that with those innovations, we don't leave some behind. So let's hear your thoughts.
Thank you. In terms of the last question or statement, indeed, and because it's new, these are the things we're working on to make sure that nobody gets left behind. So you would find that many schools are reaching out to parents to find out how they can help, how they can assist in getting that kind of access. The government of Grenada has also done their bit in that regard, providing internet access, providing some devices and so on to our students. So hats off. So over time, that inequity would be ironed out. As it relates to our differently abled students, where they have their teachers who they have been engaging with in normal classroom engagement. These teachers now are exploring the best methods to engage these students because they have the skills in terms of teaching them. So they are engaging them. What we have to, one of the challenges we have is the difference in learning style. And how do we cater for the different learning styles using this new approach? Now, if you're in the classroom and you're practicing your classroom management techniques and so on, it is easier to set this student to do something while you move to the other group and work it out. You have groups on Zoom, but that hands-on control and monitoring is a challenge. So we have that here, not just for the differently able students, but also the average or regular student who has a different learning style. So finally, Kelon, our teachers. As I was saying, I want to big up my colleagues, my comrades, because indeed this is an exciting time for education, and teachers in Grenada love to teach. Teachers love to work. As a unionist, I could tell you when it comes to our money, we would kick hell. We would raise a storm, but we love to teach. This is what we live for. And this is why we are so passionate when it comes to what we deserve. Teachers, keep engaging. We know that it's a challenge for some of you, but keep pressing on. You could make it. We know that we love our students, and each teacher is going to go above and beyond to ensure that he or she engages with his child, with his student in his class, to make sure that they get the best. So keep doing it. We know that it's different times. Self-care is important. So let's protect ourselves. Wear your mask, sanitize. If you can, and you're satisfied that this is a move for you, get vaccinated. These are the options that are available, but that's what you need to do. And let us ensure that we do our best, continue to do our best to engage our children and to help to take the education system forward. Because really, the psychological safety that our students need lies really in our hands. If we could create a semblance of normalcy for them, then on the other side of this pandemic, we would have a good individual to work with and to take the process forward. So let's keep going. Let's keep working. Blessings to all. We are going to make it. We are Grenadians. We are resilient, and we can and will make it.
As the great Black Stallion says, we can make it if we try.
We could make it if we try.
Yes, you can use that as a slogan. I hope the political parties don't use that song. Okay. All right, Brother James, thank you again. And please continue to provide feedback to the Bubb Report. We welcome feedback, critical and positive. I don't take things personal when it comes to this program. This is a people's program. And so I welcome all feedback and suggestions. So thank you again, Brother James, for appearing on the report. Folks, that was Brother... I think you wanted to say something. Go ahead.
Yes, I just want to encourage you to keep this work going because there's a need for this. One of the difference we have in our society now as compared to when you and I was coming through the system, growing up. You listen to the radio, you listen to the television, and you are educated. Mm-hmm. When you needed to find out who was the prime minister of the islands, all you needed to do was put on the news, and you got it. On a morning on the buses, you were educated. There has been a shift. It is now all about hype. And so we have less of the educational engagement taking place in media. And this is where Dr. Kelon Bubb is making a difference. And comrade, hats off to you. Keep it going. This is needed. I have spoken about what I call the intellectual revolution in Grenada. And I believe you're a leader in this process. Keep it going. Forward.
Well, those are some forward ever, some big shoes to fill, but certainly this this is my way of giving back to the land of my birth. So thank you for your endorsement, and I will continue doing my part to raise the bar and lift the standards of journalism in Grenada, Carriacou, and Petite Martinique. And certainly, viewers and listeners, I want to thank all of you for participating in today's program. This was a heavy program. We discussed a lot with respect to COVID and respect to how COVID continues to impact various communities. But we felt it was important to highlight the ways that COVID-19 has impacted and continue to impact the most vulnerable among us. Whatsoever we do to the least of our brothers and sisters, that you do unto us. And so on this note, on behalf of my production team, on behalf of my hardworking producers who helped me to put this program together, I wish to thank all of you for your continued viewership and listenership, and we will see you next week. Have a great week. Bye-bye.